We've seen that with Ebola. We're seeing it now with the coronavirus. There was an important report that came out last year from a group called the Global Preparedness Monitoring Board. They're an independent group, and what they've basically said is, we're not ready. Individual countries aren't ready, and the world isn't ready for a big outbreak like this. And they've really pointed out that the international community as a whole and individual countries have not invested in preparedness. You know, we start paying attention to preparedness only after the most recent outbreak, but then we forget about it. What we really need is a culture of preparedness at country level and within the culture, within the international community. We really have to take this much more seriously, because we're seeing not only the public health effects of this outbreak, we're seeing broad economic effects, we're seeing the social impact, and we're starting to see the political impact as well. So investment in preparedness is absolutely vital for all of us. We certainly hope so. If you look across the globe, there are many countries where the investment in healthcare falls well short of what it should be. We'd like to be seeing up to 15% of government budgets going to the health system. There are many countries where it's well below 5%. So I hope this is another wake-up call. We thought Ebola might be the wake-up call that we needed. We haven't seen countries invest following that lesson, but hopefully we'll learn the lessons this time. Well, I don't think it's just an issue for Middle Eastern countries. I think our level of preparedness around the world is not up to the level that we require right now. I think the capacities of countries across the Middle East vary substantially. You've got some very well-developed countries, such as the UAE, such as Saudi Arabia, which have more capacities, but they need to further accelerate their preparedness. The biggest concern right now in the Middle East are those countries with weaker health systems, particularly those countries undergoing conflict, such as Yemen, such as Somalia, such as Syria. We're very concerned that if coronavirus gets into those countries, we could see an acceleration of the outbreak. So we're really focusing our support, we're prioritizing those types of countries for international support from the World Health Organization and other partners.